Hello everyone, my name is Richard Armour and I'm an interim paramedic practice leader with BCEHS clinical and medical programs. The October clinical practice update includes a number of practice changes related to new BCEHS low acuity pathways, the BCEHS cardiac arrest report, the interior waiting room criteria, and a number of reminders around ASTaR practices, alternative destinations, and ongoing research within BCEHS. Strongly recommend that all paramedics take the time to read through the full practice update this month. And just including this short video review of some of the new pathways that we're introducing in the month of October. So specific to the low acuity approach to care, we have 3 new ASTaR pathways, one of which is provincial and 2 are currently in the Vancouver coastal and Fraser regions only. We're currently working with our health authority partners to expand the other 2 shortly to the rest of the province. These clinical pathways will go live on October 18th with paramedics to complete the Learning Hub course to be released on Monday, October 4th, prior to October 18th to enroll patients in these pathways and ensure they're familiar with patients who may benefit from this alternative approach to care. Paramedics using these pathways are expected to complete a full assessment, which includes 2 sets of vital signs as a minimum, and a full review of systems, and to contact Clinical for care planning if the patient meets the generic UPCC criteria and pathway-specific criteria. Clinical is a mandatory consult to ensure UPCCs are able to accept the patient and are clinically appropriate. The PS group will support in identifying the most appropriate place for a patient. A list of the available UPCCs is in the handbook under Hospital Information and are currently being added to Siren and CAD. Please take the time to review this list of UPCCs at your leisure. To facilitate the current and future pathways involving UPCCs, a generic criteria is currently applied to all UPCC pathways with additional specific criteria for any relevant pathways. The generic UPCC referral inclusion criteria is patients aged between 17 and 70, vital signs within a normal range, which is a NEWS2 of 4 or less, and no score of 3 in a single category, not intoxicated by drugs or alcohol, no acute mental health concerns as the reason for the presenting complaint, patients who are cognitively intact and able to ambulate safely and independently, which is inclusive of patients who use mobility aids and are currently mobile at their normal level. Patients need to be able to tolerate oral rehydration if required, and the patients need to be willing to redirect to the UPCC with the mandatory consult to Clinical to confirm that the UPCC is able to accept the intake. Patients are excluded from the generic UPCC criteria if they have serious trauma or dangerous mechanisms of injury, any cardiac symptoms or respiratory distress, abnormal vital signs including SIRS or possible sepsis, a suspected TIA, any recent seizure activity, an acute mental health concern or an acute substance use concern, and any infectious diseases requiring isolation. So these inclusion and exclusion criteria apply to all 3 subsequent pathways when we consider patients who may be eligible. The first pathway that will be introduced is in Vancouver Coastal and Fraser Health for patients with minor wounds. Patients with minor lacerations or abrasions without a significant mechanism of injury or other compounding injury will be eligible for conveyance to an urgent and primary care center as available within the community. The patient must meet the generic UPCC criteria, have a NEWS2 of 4 or less, and have a minor laceration or abrasion that is unlikely to require in-hospital management and could benefit from some wound care and closure. Patients are excluded, specifically in the minor wounds pathway, if there's an inappropriate history suggestive of abuse or sexual assault, patients who are pregnant or have a spinal cord injury, and some wounds will need to be conveyed to the emergency room, as is the current process. These patients are those with distal neurovascular impairment, suspected muscle or tendon damage, pain which can't be managed with oral analgesia, and significant wounds to the face, hands, feet, joints, and genitals. The second pathway is also applicable only to Vancouver Coastal and Fraser Health at this time, and is for patients with minor allergic reactions. In this pathway, we're looking to capture patients with an acute minor allergy rather than a chronic rash. For patients with minor allergy, such as a widespread rash, local inflammation, unresolved pain or itch, or an unresolved rash following an exposure to an allergic substance, they may be conveyed to the urgent and primary care center for connection with primary care, ongoing monitoring, and follow-up with specialists as required. Patients are excluded from this pathway if their presentation is consistent with anaphylaxis, if they have isolated angioedema as the presenting complaint, if the patient has a history of anaphylaxis, and if the patient has been administered epinephrine, which includes both EpiPen and Paramedic administered epinephrine. The third pathway is for patients with minor burns, and this pathway is provincial. There will be a designated button in Siren under clinical pathways next to our current pathways for palliative care and influenza-like illness. And please note this pathway is only for thermal burns, as chemical burns are considered a major burn regardless of the total body surface area affected. The patient should be assessed with 2 sets of vital signs, a review of system, and ensuring the patient meets the below criteria. Paramedics should provide oral analgesia as needed and a minimum of 20 minutes of burn cooling. A mandatory consult with clinical is required, and if the patient meets the criteria, paramedics may provide advice to the patient to follow up with their own general practitioner or nurse practitioner, and may recommend the patient attend a pharmacy for adjunctive burn treatments such as soothing lotions. If the patient has unreliable access to the primary care system, in Vancouver Coastal and Fraser Health, the patient can be transported to a UPCC if they are available and open within your community, whilst in other parts of the province it may be most appropriate to convey to the ER as the usual process to assist the patient in being connected with appropriate services. Use your discretion in these cases and collaborate with the paramedic specialist for care planning. For the minor burns pathway, we're looking for patients who meet the generic UPCC criteria, have a NUS2 of 4 or less, and superficial only burns with a less than 20% total body surface area. Patients with partial or full thickness burns are excluded, as well as those with an inappropriate history which may suggest abuse, and patients with prolonged smoke exposure are also excluded. As a summary, this month in October, we have 1 provincial ASTaR pathway launching for minor burns and 2 urgent and primary care center pathways in Vancouver Coastal and Fraser Health for patients with minor wounds and allergy. The pathways go live on October 18th, and a Learning Hub course will be available to paramedics from October 4th to complete to familiarize themselves with the pathways inclusion-exclusion criteria, and also includes a review of the pathophysiology and management of patients with minor burns, minor wounds, and allergies. Paramedics in all these pathways are to complete an assessment including 2 sets of vital signs as a minimum and a review of systems, and a mandatory contact to clinical for care planning if the patient meets the generic UPCC criteria and any pathway-specific criteria. For paramedics in the Lower Mainland, a list of urgent and primary care centers is now available in the BCEHS handbook under Hospital Information for Fraser and Vancouver Coastal Health. Thanks everyone. As we enter this new integration with primary care, we are looking for your feedback as to patient populations you think would benefit from these pathways, and we'll continually be monitoring the success of these pathways to expand in the future and in the short term.